Hey, good morning, guys. So it's Monday morning here. Unfortunately, I'm not able to be with you today, so I figured I would record some stuff this week, show you a day in the life of a dentist, or at least in day in my life. So I'll get started here, just show you what I go through every day, kind of give you a good feel for what it's like to be me and my job. So it's about 6:45, 7 o'clock, starting off the morning. Just coming on in and we'll get things turned on and rolling here pretty soon. And so this is my office, and I'm going to right now sit down and log into the computer and take a look at what my schedule looks like for the day. This right here is what a typical schedule looks like for me. So on this day, when we're looking at it, the way it kind of lays out is this solid blue right here is labeled Dr. Slivka. These are the patients I see throughout the day. Then I have 3 hygienists working on this Monday, and they all see their patients. So then what I'm doing is I'm seeing all of my patients, as well as taking time to step over and see this exam, back to see my patient, see this exam, got 3 other exams over here. So what the hygienists do is they clean the teeth, and then I basically fix the teeth. It's kind of what it comes down to. And so pretty busy day. This day we're looking at roughly right around 30 patients. All right, so to start off every morning, we come in here for our morning huddle. This is most of the team, not everybody. Just say hi, we come here, we go over the schedule. All these ladies are the source of probably about 85% of my stress and problems, but they're also probably the source of about 90% of the happiness when everything goes well, right, ladies? That was good. So we come in here, we take a seat. We'll take a second now and go over our schedule for the day. Here's a quick photo of my first patient of the day. This is what we call your basic drill and fill appointment. Old filling, little crack there. I removed all the old filling and the crack and the decay that was there, and started cleaning it up, put a little band in there so I could put a filling in. And here's the final thing. Final filling. No big deal, basic filling. All right, so we're with our, third or fourth patient today. And so we won't tell you her name and we won't show her face either. But so what we're doing is we're doing a crown on this. And so if you look at the setup, this is Kelly. She got everything set up for me. You see it's completely organized. The way it should be. Good job, Kelly. And so if you take a look, Crystal, you can get a view of the screen right here. So behind me, I've got all the x-rays pulled up. This right here is a look at this tooth we're working on. Decay underneath a large filling right here. So we're doing a crown. So once I get that prepped, I'll show you what it looks like, and we're gonna go from there. So we just finished prepping for the crown. I want to show you guys how we scan. There's a lot of digital work that goes into dentistry now. It's a lot different than what it was when I was growing up and when your parents were growing up. So let me show you what Crystal's doing to take this. She takes looks like a little photo of the tooth, and she down here on the bottom left is what the scanner is seeing, and then it's piecing it together right here.
That truck on the back of it. Okay?
Yep, so we did 2 teeth on the top. So we just finished doing that crown. We're on to our next patient here, and in here we're going to be doing an extraction. I'll show you guys the x-rays, what the tooth looks like of that. This is our little setup right here. We got a bunch of instruments. My assistant already has everything set up, so we'll get this going. All right, so the extraction we just finished doing, if you zoom in on this right here, what we do with this one, this is a tooth that was infected. Clearly you can say it's all broken off right here. So I took my handpiece, which you guys all call the drill. I took my handpiece, cut this in half right here. One root, took out the other root, kind of scraped it, cleaned out the infection. And so that's what we did on him. And on to the next patient. Guys, this case right here. So this one right here is a patient where we're doing 6 crowns on her front teeth. And so the reason for this is, you know, a bunch of cavities, a bunch of old fillings in there, and aesthetics didn't look so great. So what we're doing is, if you take a look at this right here, these are actually the top teeth right here. I'm gonna flip it upside down because then I'll drop them all over, crowns all over. But so this is what the crowns look like. Right here is if we I showed you guys how we took that scan of the crowns. So we take the scan of the crowns, we send it to the lab creates this model right here. And I work with an awesome lab who does extremely great aesthetic work. And so now the goal is he sends these back to me. They look beautiful. Currently, this is what her mouth looks like. It looks exactly like that. These are a custom scan of what the teeth look like. And now what I do is I take a look at these crowns and I make sure that the crown seats down all the way and is closed right there. We don't want a gap between where the tooth is and where the crown starts right there. So now I go put these on in her mouth. We take an x-ray, make sure everything is good. And then we cement them on for forever. So we check to make sure she loves the aesthetics of them first. Okay, let me show you something else I'm working on here. This right here, between patients and stuff, you know, I go from room to room seeing patients, some seeing exams, cleanings, some of the treatment I showed you today, and then also spend time treatment planning. This right here is a 3D CT scan that we got of a patient who's looking at getting an implant surgery. And so it looks really weird to you, but basically what it is, if you look at this view right here, this is a face kind of fanned open. I'm gonna see if I can zoom in on it and show you a little bit here. So what we're looking at here, there we go, I can make this big. So what we're looking at here is this patient doesn't have any teeth on the top at all, has a full denture, doesn't have any teeth in the back right here. And so without any teeth in the back, clearly she can't chew and she has a partial denture that flops around and moves around. So what we're doing is we're doing an implant in this one. You can see right here, we put a dental implant. It's basically like a screw that we put into the bone down here on the left. Then on the right, I'm gonna put another one in right here. And so what I'm doing back here is I'm treatment planning it. I'm going to different measurements and measuring the width of the bone from right here to right here, and also the depth of the bone from right here down to the nerve. And so there's a bunch of stuff like that, so I got to make sure we treatment plan it, make sure I get the right size implant, and when I do the surgery, I don't put the implant either outside the bone or into the nerve or anything like that. So I spent some time treatment planning, doing clinical notes. The other day, I spent a lot of time back here going through resumes, trying to hire somebody. Sometimes I have the office manager do that. Sometimes I take care of it myself. There's a lot of things that kind of go in and out of what I do on a daily basis. It's not all just sitting over patients. This here is a patient who came in today, and we weren't planning on doing this, but he said, look, I broke my tooth. And so we kind of modified what we were going to do and started fixing his tooth instead. And here's a speed up version of what I did. You saw the before where the tooth was broken. And so I took that little plastic band out that I used to contain the fillings. I put it in, and now you can see me polishing it up and trimming it up and really smoothing it over so it looks like his other teeth. And so these oftentimes are sometimes the most difficult ones, where a patient comes in, the tooth is broken, and you just kind of have to freehand it. So there's definitely some artistry that goes into it and some contouring and an aesthetic aspect that sometimes is a lot of fun, and other times it can be pretty difficult and tough to get it just right and get the patient happy. So here is the before photo again where he fractured his tooth, and here is the after photo. Patient was real happy and it turned out really well. Yeah. Mm-hmm. Okay, so we're just finishing up the day here, and our last patient today, Crystal, you can zoom in on this right here. This is a patient that came in, teeth broken off right here, missing these teeth, kind of like the scan I showed you in the other one. So these ones we're doing a denture for them, so we're going through and extracting all these teeth right here and putting a denture. And here's our, maybe I should have warned you guys or something a little bit, but here's the 6 teeth we took out today. And then we put a denture in for them, and it's a variety of things. So as being a dentist, you know, we do the fillings. I showed you a crown. I think I showed you a photo of a filling I did as well. We do extractions, plenty of surgeries, tons of stuff we can do. Whole variety of things. So that was our last patient today. Okay, so that's my day. There was a lot I didn't show you. Like I showed you at the beginning on the schedule, about 30 patients today. Going around, seeing patient to patient. Good things, can try and anticipate some of your questions and answers. Good things about the job that I love. Love working with people. Like I said, I get to see about 30 different patients a day. Sometimes they're the best part about my job, and sometimes the most frustrating and difficult part about the job too. But I like that everything changes, always different every day, different procedures, different patients. That's really good. Absolutely love working with the staff. So here's the thing. I showed you some of the procedures that I do as a dentist, right? Most dentists own their own dental practice, or a lot of dentists do. And so as you own your own practice, you are then both a small business owner, a boss, a manager. You hire, you fire, you do everything. So for me now, everything I showed you, that is probably equates to maybe 10% of the stress that I have. The 90% goes back to the running the business, running the practice aspect. So what I didn't show you is I got tons of emails here, everything going in from payroll, hiring people, working with permits at the office, running the schedule, keeping staff happy, everybody happy, figuring out how much to pay everyone, overhead. You got the lease, you got the whole business side of how much it costs to run a business. And so it gets back to a couple of things, okay? To be a dentist, you basically do your 4 years of undergrad, and then it's 4 years of dental school. The prerequisites to get into dental school are almost the exact same stuff as what it is for medical school. It takes 4 years for dental school, after which point, when you finish after the 4 years, you can go straight out and practice, which is what I did. And you learn, and afterwards I continue to take education. I have continuing education courses that I have to take, a certain number every couple of years. And so, and those classes can range everything from a couple $100 to $10,000-$15,000 for really good hands-on courses. And then those are the courses that you get training to be able to do the implant surgeries and those type of things. And so good stuff. Anybody has any questions or anything, I'd love to talk to you and go over stuff. Don't hesitate to reach out. Thanks. Hope this helped, and hope it was a little more enjoyable than just me sitting here like this for 10-15 minutes. Talk to you soon. Bye guys.